Hi, welcome to a panel discussion of the sets of services within Children's Integrated Services, or CIS. I'm Ann Dillenbeck, a CIS state team member. My role is Program Improvement Manager. We have a panel today of representatives from each of the four sets of services, which are early intervention, specialized childcare, early childhood and family mental health, and Strong Families Vermont home visiting. Our panel also represents various CIS regions across the state of Vermont. These services are each their own specialty, and together they share some CIS fundamentals, such as a strength-based and client-centered approach, the provision of service coordination, the connection of families and clients to community resources, and sharing information about healthy child development. So I'd like to tell you who you'll be hearing from today. We have Crystal Davis from Early Intervention, Maura Shader from Early Childhood and Family Mental Health, Kimberly Buxton from Specialized Childcare, and for Strong Families Vermont home visiting, we have a group, Kelly French, Shelley McSweeney, Karen Bilowski Branch, and Heidi Gillespie. And they'll introduce themselves, and you'll see their titles as they answer a series of questions about their set of services. We thought we'd start with early intervention and turn to Crystal, who works in Washington County. So Crystal, welcome. Could you just introduce yourself a bit?
Hi, my name is Crystal Davis, and I manage early intervention in Washington County. I've been with the program for about 4 years now and manage a crew of about 6 early interventionists and as well as some specialty providers in our region.
Wonderful. So Crystal, what would you say is the goal of CIS early intervention? What outcomes are we looking for when families receive CIS-EI?
I would say that the desired outcome for our set of services is to improve a child's quality of life and to work toward, if not meet, their developmental milestones. And we do this by coordinating as well as providing services to children and supporting parents by modeling skills that they can use with their child in between visits.
And what age group of children does CIS-EI serve?
We serve children birth up through to age 3 or 36 months.
Great. And you talked a little bit about modeling. What else does EI offer?
We offer coordination of specialty providers, such as speech therapy, physical therapy, sometimes nutritional consultation. And we also will refer to Early Head Start, the Vermont Association for the Blind and Visually Impaired, or the UVM Parent Infant Program, which assists children who are deaf or hard of hearing. We also provide developmental education to families and tips for parents about how to encourage learning through play. And services are provided at no cost to families and are delivered to our families in the child's most natural environment, which is typically in their home space or in childcare. Sometimes we do go out into community playgrounds and provide services there as well.
Great. I'm glad you talked about tips for families. And so when you're working with a family, do you consider your services only for the child?
No, it's really for the whole family, because when you're working with a little one, parents are always concerned about making sure that their little one meets the milestones that have been expected, I guess is the right word for them. And sometimes families rely on the early intervention team to help support them do that.
And you mentioned early childhood education. If a child is attending a childcare program, how might you collaborate with them?
We will make appointments to go into childcare. We don't just drop in. We make appointments to go in and see the child there. We leave visit notes with childcare and have discussions with them about and give them tips as well as to help the child in their time there at school, childcare. And then we also will sometimes include them in teaming when we have a team meeting with a parent who may have a child that has some extensive needs. So we involve them there as well.
Right, and you would always have family consent.
Absolutely.
So Crystal, thinking statewide, what type of agencies deliver this service?
In Vermont, a variety of agencies deliver the service, but the most common are parent-child centers. But I also know of a home health agency as well. So in Washington County, we are housed within a parent-child center, which is the Family Center of Washington County in Montpelier.
Great, thank you. So to just finish up, Crystal, could you share one example of CIS early intervention supporting a family in partnership with at least one other service within the CIS array?
Sure. The example that I can think of was a young family whose child was born while they were homeless and living in a hotel. The baby had some medical issues as well, so they were served by nursing to begin with, and they went to the hotel and saw the family there. And then they also received services from Family Supportive Home Visiting, who helped the family by coordinating some mental health supports, and also help them fill out some housing applications and things like that. And then when the child got a little bit older, they were referred for early intervention. And we saw him in the home and at childcare for developmental delay, which eventually went on to a diagnosis of autism spectrum disorder. And then once he turned 3 and he, quote unquote, aged out of the early intervention program, they continued to be supported by Family Supportive Home Visiting. And they were eventually housed, which is wonderful. And they have, throughout the whole process, were supported. The whole family was supported, and it really improved their lives. The most recent follow-up that I have on them is that both mom and dad are in college programs, and they're just working through life as it comes to them. I believe the Family Center is still involved with Family Support Home Visiting and some housing support as well. So yeah, it's a really nice win for them.
Thank you, Crystal. That's a great example of the wraparound support that CIS can provide. Thanks so much. Now we're going to explore a little bit about early childhood, family mental health, and speak with Maura. Maura, could you introduce yourself?
Hi, my name is Maura Shader. I'm a clinical supervisor in Windham and Windsor County over here at HCRS, who partners with CIS.
And Maura, what would you say the goal of early childhood family mental health is? What are the desired outcomes for families receiving this service?
We are really a preventative model as much of CIS is. So we are trying to prevent major mental health diagnoses for young children later on down the road who have experienced stressful events, trauma, or ACEs, as we often refer to them to, adverse childhood experiences. So we're trying to make sure that with early intervention to the child and the whole family, that we are preventing later on more complications happening for that child down the road.
Great. So what does ECFMH offer CIS clients?
We offer a lot of different services. It really depends on what the family is looking for and what they're looking for support around. So we can offer really short-term services around consultation that might be 1 or 2 visits with a family that might be really concerned about an event that's happened in their life or behaviors that they're not sure if they should get further assessment with for their young child. Or we might offer long-term support that might be closer to a year or just over a year of clinical support, consultation, providing psychoeducation to the family. We really view that even though the child's being referred to our program, our early child and family mental health program, it's really the relationship that's coming in that we're trying to support, because we as a program approach that we're going to help that child through the relationship that they have with their primary caregiver. So our goal is to support and scaffold that relationship and answer what that might be, providing parenting consultation and working one-on-one with a parent around their concerns, providing education around development, around psychoeducation if they're coming in and they're having really concerns about, like, is this something, a mental health issue that I should be looking further into? What our program also really focuses on is adverse childhood experiences and trauma, and how much those, when a child experiences that in their life, how much that can kind of mimic other mental health symptoms that can become really confusing for parents and providers in the community. So our goal is to kind of provide education and intervention to prevent a diagnosis from happening for that child. If the child is turning 6 and it seems like those concerns are still present or have gotten worse or kind of shifting into something else, we might support that parent in getting connected with more intensive clinical-based services or further assessment through our state, whether that be through an area mental health facility. I'm located at the designated mental health facility for our region for Windham and Windsor County, and that might look different for other areas as well.
Great. Thank you, Maura. I think, like you said, it usually is the designated agencies, the community mental health agency in the region that delivers these services. And you mentioned when a child turns 6. So what age group of children do you serve?
We support 0 through 6-year-olds, but we are also currently providing consultation education for parents who are currently pregnant or postpartum. And that's kind of new for our program, just to provide some early intervention for parents who are concerned about possible postpartum or have just concerns about a new family member that's about to arrive, or who have just given birth and there's just a general concern that there might be postpartum happening for that parent. So that's a little bit newer for our program, but 0 through 6 is what we provide services for.
So exciting. I think in other regions, the age may go from 0 through 5. But thank you for sharing what happens in your region. There is variation across the state. And for a last question, could you share an example of CIS ECFMH supporting a client, a family, in partnership with at least one other service within the CIS array?
There's many. I think it's very common for us to partner for many different families, whether that be early child and family mental health partnering with someone in case management to help support a family get housing. Or oftentimes we get referrals. A child has gone through the early intervention program, the 0 through 3 program for developmental concerns, and there's still something going on for the family. So our EI partners will refer to our program to kind of pick up and work with the family. So an example that I have is a child that was born and referred to EI right off the bat due to kind of coming into custody 10 days after they were born and hitting the NAS requirements for the early intervention. So early intervention provided support when the children did phase out and graduate from the early intervention program. So that program ended, but then came back through to our program, which I think is very common through CIS. When kids can come in and out through those age ranges many different times. The behavioral support person on our early child and family mental health team provided support to that child and their parents, and the child care provider. But they were hoping to have more mental health interventions. So they referred to our team. And so we kind of, even though there's different providers maybe kind of happening in succession on our team, I think it's a good example because we held this family for the full 6 years of providing support and intervention along the way, and then referred that family on for clinical intervention after they had finished with our program. They received different areas of CIS support along the way that I think were very helpful. And I think it was a good example of how we can kind of stay with a family from that 0 to 6 age in many different programs.
Yep. And just for everyone, can you define NAS?
Oh,
It's
can I
neonatal abstinence syndrome.
Thank you. Yes. Yeah. I'm like, no, I don't know. Can I? Yes. Yes.
Just doing some jargon busting.
Yeah.
Thank you so much, Maura. That's a great introduction to your set of services. So we're going to go ahead and hear a little bit about specialized childcare and hear from Kim. Kim, could you introduce yourself?
Hi, yes, I'm Kimberly Buxton. I am the CIS Specialized Childcare Coordinator for the St. Johnsbury and Southern Essex counties.
Great. And what's the goal of specialized childcare, Kimberly?
Yeah, there are several goals for specialized childcare. One is for children being able to access childcare. And the second is for those children to be able to attend childcare programs that are considered specialized. So those specialized childcare programs will have an extra designation as being a specialized childcare program, which requires an extra set of trainings.
Great. And so what do providers offer for clients of specialized childcare?
Sure. So when I am working with a family and other specialized childcare coordinators are working with families, we offer, sometimes we're the lead for a family and we help case manage. And then we will also help families find specialized childcares that they can attend. And we authorize the use of the child care financial assistance so that families can receive help paying for those childcare services for their entire family. And then we will also work with providers to help them, childcare programs to help them with their program if they need help in the childcare setting, if they have concerns about how their routine is going or maybe how their environment is set up, so that we can help offer guidance and resources for them as well.
Great. And so you answered part of my next question in talking about serving early childhood educators. What age group of children do you serve?
Sure. So children can enter childcare starting at 6 weeks. Sometimes they can enter earlier if there is a need. And then we serve children up past age 13. Sometimes children with special health needs can attend childcare after their 13th birthday.
Mm-hmm. But through CIS, it's really through age 12.
Sure. We can authorize past age 13 for childcare financial assistance.
Right. Thinking statewide, what type of agencies deliver specialized childcare?
Sure. So there are a range of local agencies. There are 12 that house specialized childcare coordinators in the state of Vermont. A lot are housed at parent-child centers, and then others are housed at local community support agencies like Umbrella in St. Johnsbury and in Newport.
Which is where you are.
Yes.
Great. As I've asked others, could you share an example of specialized childcare supporting a child or family in partnership with one other service or more within the CIS array?
Sure. So it's very common for families that are working with specialized childcare coordinators to also be working with other CIS services, children's integrated services. So early intervention may be working with a family that's also working with a family support home visitor. They may also have work with speech, occupational therapy, physical therapy. There could be a range of services that a family might use, and may also visit the childcare program to provide those services as well.
And so when all those services are involved, what does a team meeting look like?
Sure. So when there's a bunch of services assisting a family, we try to work together and be one point of contact for the family, so that there's one case manager for the family's one plan. And then those services all kind of coordinate their visits and time with the family, so that a family doesn't get overwhelmed with everything that might be supporting them, because it could feel overwhelming if there are a lot of professionals working with a family.
Thank you, Kimberly. It's great to hear about all that specialized childcare offers.
Thank
and
you.
For the fourth set of services, not that they're in any order, but just in the order of our conversation today, we're going to talk about CIS Strong Families Vermont, which is our home visiting services. Within Strong Families Vermont, we have sustained home visiting and responsive home visiting. So you'll hear a little bit about the difference between those as we go through. So we're going to start with sustained nurse home visiting, and Karen will introduce herself and talk about what that program's actually called.
Hi, I'm Karen Golosky Branch, and I work for the Vermont Department of Health and the Family and Child Health Division, and we fund and administer the sustained home visiting programs, and the nurse home visiting program is one of the two sustained or evidence-based home visiting programs that Vermont provides. So often when we talk about sustained, it's synonymous with evidence-based, where we are operationalizing and implementing a particular model. And so for nurse home visiting, we are using the MESH model, which stands for Maternal and Early Child Sustained Home Visiting. That's a mouthful. Or MESH, MECSH is the acronym. And this is an international home visiting program out of Australia that Vermont began to implement about 4 years ago. And so we have nurse home visitors across the state who are trained and certified as MESH nurse home visitors, and they provide this very specific sustained or long-term nurse home visiting program for CIS families.
And within Strong Families Vermont, we also offer responsive home visiting, and one set of services is responsive nurse home visiting, and Kelly is going to talk with us about that. Kelly, if you could introduce yourself and tell a little about your set of services.
Sure. I'm Kelly French. I work at the Family Place in the Hartford region. I'm the responsive nurse home visitor there, and I also work in the early intervention program as a supervisor. And the responsive nursing home visits, those services, our desired outcome is to improve the health and well-being of clients and families, fostering positive parenting skills and healthy habits. We build on and enhance client and family strengths. And families identify goals that they want to work on, and we support them in feeling confident in their decision-making and their healthcare and their parenting.
And where do you offer those services?
The most common agency, or I would say the parent-child centers, is where you would most commonly find the responsive nursing home visiting.
And also home health agencies provide that as well. But where do the families receive the services?
So we provide home visits, but we can be flexible. We can meet families at a park. We can meet them on their lunch break at work. We can do telehealth. It's really meeting the families where they're at.
Great. And what population do you serve? What age of children and people do you serve?
Yeah, we serve prenatal and postpartum up to 60 days, and then children birth through age 5.
Great. And could you share an example, Kelly, of responsive nurse home visiting supporting a client or family in partnership with another service within CIS?
Sure, I echo what was said earlier. I think that this program partners with many other CIS programs, but an example that comes to mind is a child who was enrolled in the nursing program following birth. The child was born exposed in utero and was receiving, it was a foster situation, so the mom was receiving some new baby support, parenting support, and also developmental monitoring. And around the age of 2.5, the child began to experience some what the parent described as explosive and rageful tantrums. And this was during the period of COVID. At that same time, the child lost childcare placement due to staffing shortages and had been in that childcare since about 6 weeks of age. So it was a huge transition. So there was consultation between the nurse home visitor and the early childhood family mental health clinician, just for some strategies to support the family, and also supporting the parent with local support groups and other resources. There was also a seminar being offered locally on handling big emotions from children to adults. And the parent utilized those resources, but was still having a very hard time. So referred to early childhood family mental health. That provider became involved, and the nurse and the early childhood family mental health provider worked together to support the parent with supporting her child.
What a great example. Thank you so much, Kelly. And last but certainly not least, we're going to talk about responsive family support home visiting, another part of Strong Families Vermont within CIS. And for that, we'll turn to Shelley.
Hi, I'm Shelley McSweeney, and I am a home visitor. My title at Lund in Burlington is family educator. Lund is one of 3 parent-child centers in Chittenden County, and I provide home visiting services to at-risk pregnant and parenting families throughout Chittenden County. And the goals of our program are very similar to what Kelly just described. In fact, I was really psyched that Kelly went first, because I was trying to figure out how to describe that. But really, I wrote it down, improve health and well-being, positive parenting, definitely preventing or reducing ACEs, reducing isolation, creating more connection. Gosh, there's so many goals that I feel like we often meet those goals just by being kind of a consistent, loving presence in somebody's home and being available. Reparenting the parent is a big piece of what I do.
What does that mean, Shelley? Can you talk a little more?
I think often the families that I work with haven't had enough connection to somebody who provides sort of steady connection and leadership and kind of a wholehearted relationships in their lives. And so helping in many ways provide that for a person so that they can see themselves as worthy, and then can feel that connection to their own child, that kind of wholehearted connection to their community and to their children and to themselves. It sounds kind of heady, but I really believe that's what we're doing.
Yeah. Thank you for describing it that way. And what age group of children do you serve?
Birth through their, I would have to discharge at their 6th birthday. And in some cases, I'm working with families for several years. That is not the norm, but it has happened because of multiple children either being born or because of all the many ACEs in a family, adverse childhood experiences. Yeah.
So statewide, it's usually the parent-child centers that deliver the service. Sometimes a home health agency might also provide responsive family support. So Shelley, to get concrete, could you share an example of responsive family support for a client or family in partnership with another service within CIS?
Sure. There's many examples. I'm thinking about a mom who completed her residential treatment at Lund with her child, and she had a couple older children who weren't with her at that time, and is reunited with her kids. She had significant challenges with her mental health, and with had a diagnosis of a substance use disorder, and was back in the community and doing quite well, and experienced relapse. And at that point, her youngest child went into custody, and then I was brought in, so was working closely with DCF, and could see that the child also was struggling with their speech articulation, at least in my less than trained perspective, seemed like there needed to be more support. So I made a referral to EI. At the same time, I was worried about what the children had experienced in the home. There was had been a history with domestic violence and lots of chaos. And so pulled in the staff from Howard Center, and was able to create really a beautiful, a very effective team that worked really well with this mom. And she was in many ways kind of the quarterback. She was able to see herself as the leader in this group of people, and she really understood her children's strengths and her own strengths. And we were able to come together to support her in a way that she felt really was effective. And I could see the changes in her own kind of sense of self, and she's doing quite well right now. Her youngest child was completed her treatment with Howard Center, is now in kindergarten, is getting still getting some speech support at school. This mom is working part-time and is saving, has a beautiful place to live, and is really, the family's doing quite well. I continue with them and will discharge soon, and that's going to be hard.
Yeah, because it's about that relationship that you were describing. And so that's a transition. And at the same time, the support will enable her to continue well without you.
Yeah, I think one of the things that we might not talk about as much is one thing that often happens as a child is approaching school, is navigating that system, helping children enroll in preschool, and then accessing services through school, and what kindergarten might mean for families, especially if a parent didn't have a great school experience themselves. And so that's another piece of it, kind of role modeling, situational kind of coaching, how to approach teachers, how to be their child's best advocate in a way that works for everybody.
And one last thing before we close, Shelley, just to distinguish responsive family support from some of the other services that we talk about, do you work very much with childcare or early childhood education providers?
I do. I'm sometimes I go to a childcare and I am in classrooms sometimes just trying to observe what might be happening and creating sort of that home childcare connection, homeschool connection. I make referrals to childcare. I make referrals to childcare resource in Chittenden County if we're looking for a slot. So I definitely am involved in that system quite a bit.
Great. Thank you so much, Shelley. Give us a good window on those services. So Heidi, we'll turn to you next and to talk about Strong Families Vermont. One of the services in that group is sustained nurse home visiting. In Vermont, that's delivered as MESH, Maternal Early Childhood Sustained Home Visiting. And it comes from Australia, but we've been using the model here for a while, and I know you've been implementing it in your region. So what are the desired outcomes for MESH?
Okay, yeah, we have a lot of desired outcomes, but primarily I'm going to focus on 4. The first one is improve maternal health and well-being, and that's to help parents through helping parents transition into their parenting journey with support in pregnancy. So the goal for MESH is to start as early in pregnancy as possible. We also want to help parents connect and bond with their children, not just the target child or the primary child involved in the services, but with all of their children. So, which is why we call this family services, because everyone is involved. We want to help families to parent effectively despite the challenges they might face. And to develop skills to adapt and self-manage on their own once the nurse is no longer involved in the services with them. That's probably the most important and primary goal that we have, is that the families don't become dependent on the nurse, but that they become and develop that ability to self-manage without that extra support. And then another very big point of ours is to help families feel connected to their communities so that they have that confidence and that comfort in reaching out for supports when they are in that period of life where they're on their own and they don't have that nurse in the home primarily. We want them to know how to reach out and who to reach out to, and to feel like they're a part of their community and can do that on their own. And those are the biggest.
Wonderful. Yeah, thank you, Heidi. And what do nurses for MESH, Sustained Nurse Home Visiting, offer CIS clients?
Wow. That's a big one. We offer home visits. Okay, primarily that's the big thing. We offer them home visits so that we can help and observe them and help them to develop these skills we're discussing in their own home environment, where they spend most of their time, where the things that they have available to them are. And so we also, should that not be comfortable for them at the time, we offer them home visits in community spaces as well. So we would be more than willing to meet in a library, or maybe at a local office that has a room that's available for meetings. We do want to always get back into the home eventually, because the goal is for these to be home visits. But when that's not an option, we offer them visits wherever we can deliver the service. We offer community support, as far as we will accompany them to a play group or to a service that's offered in the community the first couple of times until they're comfortable to go on their own. We do developmental screenings. We screen for depression and anxiety postnatally and in pregnancy. And then we offer referrals to the places in the community that can help to fill that need that may be discovered during those screening times.
Right. It sounds really comprehensive. And what population does MESH serve?
Okay. Our population is, we try to, as I mentioned earlier, try to get in as early as in pregnancy as possible. So we're serving families in early pregnancy and until the child is 2 years of age. That early pregnancy, there's a little bit of a caveat there in the sense that moms can be enrolled in the program anytime up until 6 weeks postpartum, or in the event of an extended hospitalization for the child, say the baby was premature or had a health issue when it was born, it's 6 weeks post-discharge from the hospital. So that's always figured out based on the individual need of the client. But primarily, we prefer to start in pregnancy until the age of 2 of the child. So this could be adoptive families. This could be foster families. This could even be transitional fostering. So if a mom needs extra support and the child happens to be in a foster home, we would support the foster family and the mother through reunification and then continue with the mother after that point. This could be grandparents. It could be anyone that is serving that child in that early childhood time as the primary caregiver.
So Heidi, thinking statewide, what type of agencies deliver this service, and specifically which agency in your region delivers MESH?
Okay, so MESH is delivered primarily through the VNAs throughout the state of Vermont. In my region, it is delivered through the VNA and Hospice of the Southwest region. It is also delivered through home health agencies sometimes.
Got it. And if you could share an example of delivering MESH and involving other services within the CIS array.
Sure. I actually probably couldn't deliver an example of something where that doesn't happen because that's such a primary purpose of what MESH is. When we're working with families, I can think of one family in particular that children had quite a few needs. They had quite a few of those despites that we're talking about. So the family was receiving a lot of services in different areas. So they would have Strong Families Vermont in there, but they also had a child getting services through early childhood family mental health. They also had their child involved in the parent-child center receiving services through EI for developmental concerns. And then they also were taking advantage of the family support childcare services. So that family was completely wrapped in CIS. We did a lot of co-visits. We did some team meetings and just all worked together to support that family. And that really happens throughout. It's not, like I said, there's rarely a circumstance where a family doesn't have another service involved. So the focus is to always be wrapping that family in services that will help them get the support they need in their launch into parenthood and family development.
Thank you so much, Heidi. You've really given us a picture. Before we close, I just have one other question about the population served. Because MESH talks about maternal early childhood, I just wonder if other, parents other than the birthing parent, you talked about foster parents and adoptive parents and grandparents, but could it be a father? Could it be another mother?
Absolutely. Whoever is the primary caregiver of that child that we start with in infancy. So we actually had a circumstance, and unfortunately it never came to fruition, but where a dad had contacted us early on, and the mom in this family had already decided prior to the child's birth that she was not going to stay involved, and dad was going to be the primary caretaker of that child, and he wanted to receive our services. And so we absolutely, anytime in that situation, it's whoever is the primary caretaker of that baby when it comes into the world, and whoever's going to be parenting it.
Thank you so much, Heidi.
You're welcome.
So Karen, we'll turn to you, Karen Biloski Branch, to talk about another sustained home visiting program. This one is called PAT, or Parents as Teachers or PAT. And I'll run through ask you the same things. What are the desired outcomes for parents as teachers?
Well, similar to MESH, because it's an evidence-based model, they're built off of research, right? That shows that if you really provide the model to fidelity, that you will see these positive outcomes or impacts on families. So for parents as teachers, it includes things like identifying possible developmental delays for children early. That's a big one. Also helping to improve school readiness for children who will be entering school. That's part of why we were interested in the parents as teachers model, in part because it also, as I know we'll talk about, it provides services through the age of 5 for a child. So it does focus very much on helping children and helping families prepare children for school more positively. It also has a focus on improving parent-child interaction and a big focus on parenting and really supporting parents in their ability to parent.
Okay, and well, first of all, who delivers parents as teachers?
In Vermont, we have, we have both the nurse sustained home visiting model, and then we have parents as teachers, which is the model we use for our family support home visiting model. So it's really family support home visitors. So these are human service professionals. They may be social workers. They're folks that have a human service or social service background and are trained to not only to provide these services, but trained in the model itself to provide parents as teachers.
Okay, and what do the family support home visitors delivering PAT offer CIS clients?
They offer a lot of different things. Parents as teachers is, there's kind of 4 components to parents as teachers. One is what they call the personal visit or the home visit. And so the work that happens there, it's also about helping to support families in making connections to resources, and which could be services, but it could also just be, different community resources, building relationships. There's a group connections component. So it's also very much about helping to decrease kind of parent isolation and family isolation. So that's one of the 4 components, is to create regular and consistent kind of group connections with and among the families that are participating in parents as teachers. It's pretty much everything and anything that a family might need. So a lot of it is around helping families identify their goals, how they want to accomplish their goals. There's, as I said, a big focus on screening for developmental concerns with children, also looking at the parents' health and well-being, and really focusing as well on what are some of the stressors or challenges that a family may be facing. So it could include things like supporting families around issues of housing, mental health issues, childcare, and there is a big component around that parent-child relationship and really working with the parents or caregivers in how they're relating with and understanding and supporting their child's development.
Mm-hmm. I know there's an emphasis on recognizing and interpreting children's cues.
Yes.
Right, as part of the relationship building.
Yes, absolutely. Yeah, and a lot of that's done through play and really supporting parents in understanding the importance of play in a child's development, and how are they building that in, and yes, that through play, how are they kind of gaining more of an understanding of their child and what their child needs, and setting up routines and ways of really supporting the family overall, but really focusing and supporting and understanding the child's developmental needs.
And I think you might have already said this, but could you reiterate what population Parents as Teachers serves?
Sure. So it is a program that can be offered prenatally up through age 5 in Vermont. Our focus is really working with families with children after 6 weeks postpartum. That's part of why we have 2 sustained home visiting models, because they're complementary to each other. And so, and that PAT can go up through the age of 5. So PAT is primarily for families with children 6 weeks postpartum, all the way up through 5.
Great.
And it's any kind of fit. It's similar in that it's any kind of family. So whoever is in the child's family, and it also includes, even though there is kind of there's an identified child because there needs to be for billing and other aspects, it is also very much a family-centered, family-focused model. So it's really working with the whole family. So who's parenting the child, and if there and any other children in the home, and really focusing on supporting the entire family.
It's terrific. It sounds like really meeting the family where it is and whoever it is.
Yes.
So thinking statewide, what type of agencies deliver this service?
Well, at this point in Vermont, we have 8 what are called affiliates, and these are agencies or programs within agencies that have met the Parents as Teachers requirements to become an affiliate, which means the program is going to be providing the service to Fidelity and everything that means. PAT has many essential requirements that go into doing the model to Fidelity. Primarily, the programs or agencies that are providing this are our parent-child centers. And then we have one agency that is in their region is the Parent-Child Education Center, and they don't have that designation of a parent-child center, but they are absolutely doing many of the CIS services in that region, including Parents as Teachers.
And as I've asked others, could you share an example of delivering Parents as Teachers along with another service within CIS?
Sure. Well, I think it really often there are other services involved. And I think that, one of the things that's such a strength of CIS is that even if there may not be other services that are open to the family, there's that ongoing aspect of consultation and collaboration that happens. So I think there are a number of ways. I think that the Family Support Home Visitors doing Parents as Teachers are doing that in collaboration with other CIS programs. I will say, I think that sometimes what also happens is that it may be that Parents as Teachers is the primary provider that's in the home, but especially because some of these children are older, so they may be getting ready to go to childcare, go to preschool. That's certainly working with the supported childcare or specialized childcare coordinators. I think is often a way that they collaborate to really support families around that particular journey of dealing with childcare. I think also early childhood and family mental health, if they may have a child that's a little older, or the child that they're working with may be experiencing some particular social and emotional challenges, they would bring early childhood family mental health in. And certainly, I think early intervention, if they're working with a younger child that may have some developmental delays, and because one of Parents as Teachers' big outcomes is doing a lot around child development and screening, they are often a good resource, and they may be in there first, and then recognize that there is a developmental delay or something happening for the child and can bring early intervention in, or vice versa. So I think they go both ways.
And if the child is older, past the age of 3, I know it's not under CIS, but early childhood special education would also
Exactly. Yes.
be part of the team.
Yes, right. And so if they are working with a child that is, moving toward, is either in preschool or moving towards kindergarten, then certainly, working and teaming with that team as well.
Great. Thank you so much, Karen.
You're welcome.
It's really great to hear about PAT from you.
Thank you.